Stand by. This is 1 minute to show. 1 minute.
Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined today with Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. We're here today to provide everyone an update on the COVID-19 situation across the state of Maine for today, Thursday, May 21st, 2020. Overall, the state of Maine CDC is reporting 1,877 cases of COVID-19 across the state, representing an increase of 58 cases since yesterday. Of those 1,877 cases, 1,678 are laboratory confirmed and 199 are probable cases. The number of individuals who have passed away with COVID-19 remains at what it was yesterday, 73. Of our 1,877 cases, 432 are among healthcare workers, an increase of 15 since yesterday. 235 individuals have been hospitalized at some point, an increase of 4, and 41 individuals are currently hospitalized, a decrease of 2 since yesterday. Of those 41 individuals, 21 are in the intensive care unit and 20 are outside the ICU. 12 individuals remain on ventilators, which is the same number as it was yesterday. Overall, 1,145 individuals have recovered, an increase of 35 since yesterday. I'd like next to provide a quick update on some of the outbreaks that Maine CDC has been actively engaged with in investigating. As to the 2 outbreaks that I announced yesterday, the case counts remain the same. At the Seal Rock facility, the number of confirmed cases remains at 3. At Woodford Family Services in South Portland, again, the case number there also remains at 3. There are no new cases that have been confirmed or detected in connection with Bristol Seafood. And the Chinbrow outbreak at a construction site has now gone up to an additional case, making the total number of cases associated with that site at 26. Maine CDC's investigation into that worksite has continued, and we now have a clearer picture of where most of the cases are from. Of those 26 cases, 11 are among Maine residents, 8 are among Rhode Island residents, 1 is a North Carolina resident, another is a Wisconsin resident, and 5 are New Hampshire residents. We're continuing to try to put together the timeline of symptom onset to try to get a better sense of where individuals may have contracted COVID-19. I'd also like to provide an update on the 100 State Street facility in Portland. Yesterday afternoon, about this time, approximately 200 individuals provided samples for testing for COVID-19. Those samples were sent to our laboratory up here in Augusta and are being run as we speak. In addition, at Clover Healthcare, there are 21 cases affiliated with that facility, 17 among staff and 4 among residents. And at the Springbrook Center, there are a total of 42 cases, 31 among residents and 11 among staff. Yesterday, we were joined by Commissioner Randy Liberty from Maine's Department of Corrections to provide an update on all of DOC's activities in connection with a single case that had been identified at the Maine Correctional Center. I'd like today to provide an update on the public health side of DOC's activities. Since identifying that first case, Maine DOC has set out to swab approximately 750 individuals in total. Thus far, as part of that effort, 163 results have come back, and all of them have been negative thus far. Those 163 results represent 64 staff members and 99 clients. Maine DOC is still waiting on approximately 200 additional samples, which again are being run at the Maine CDC laboratory. And then on top of that, there are an additional 375 or so swabs that Maine DOC will be continuing to take over the next 24 to 48 hours. That process is currently in progress at the Maine Correctional Center as we speak. But again, to recap, thus far, all of the samples for which results have been obtained have been negative, and additional samples are pending at the Maine CDC laboratory as we speak. I'd like to next provide an update on some of the vital medical statistics across the state for vital resources. Overall, there are 387 total ICU beds, 165 of which are available. There are 318 conventional ventilators, 252 of which are available, and there remain available 439 alternative ventilators. I'd like next to provide an update on some of our efforts to push out swabs and viral test media to healthcare facilities across the state. Before I go into the numbers, just a bit of a backgrounder. Although Maine CDC has now greatly expanded our capacity to provide testing at our laboratory, we also need to make sure that we are equipping healthcare providers with the necessary tools that they need in order to take those samples. And the two most important tools they need, in addition to PPE, are the swabs themselves and something to put them in order to transport them to our lab. Nationwide, there's been a shortage of both of those things. But over the past 2 weeks, Maine CDC has been receiving shipments of those swabs and transport media from our colleagues at FEMA. We've been receiving them and trying to push them out as quickly as possible because we know healthcare providers on the ground need them. Just today, Maine CDC will be fulfilling 21 orders for swabs and viral transport media. This represents 8,700 swabs and 8,300 viral transport media kits that are being delivered just today. On hand currently, Maine CDC has 14,000 swabs and about 5,000 test kits. These are, again, the viral transport media that are needed in order to send the swabs to Maine CDC's laboratory. We believe that we will be receiving additional shipments from FEMA, but until those are in, as those come in, we will continue to process orders. We do ask that any healthcare providers or facilities who may be tuned in right now make those requests for additional swabs and transport media through the same process as you would have to ask for PPE, which is to say, please make the request of your county EMA. The county EMA directors will route those immediately up to Maine CDC and MEMA, where we'll be able to fulfill them. We do ask that you, if at all possible, not call the Maine CDC laboratory. We would much prefer you go through the process and alert your county EMA, who again will get that order up to us, and we'll get it into queue for delivery as we can. I'd like to next provide an update on something I mentioned a day or two ago, which is the receipt of 8 additional cases of remdesivir. Maine CDC yesterday evening did receive 8 cases of remdesivir from the U.S. government. This is enough for approximately 40 individual patients. This morning, we turned those cases around and shipped them to healthcare facilities across the state. And I believe by now, each and every one of those shipments will have been made. This latest delivery of 8 cases comes on top of 10 cases that Maine CDC shipped out about a week ago, and then 7 cases that we shipped out about 5 days ago. We've been told by the authorities that we will, specifically the Assistant Secretary for Preparedness and Response, that there will be subsequent shipments that will be coming, but the next shipment will probably not be until early June. As we receive more shipments of remdesivir, we'll be sure to keep everyone updated. And finally, a quick update on our activities in concert with the National Guard to provide fit testing opportunities for healthcare workers. Thus far, the National Guard has undertaken and fit tested 1,119 healthcare workers across the state. But they still have more to go. There are still 579 individuals who the National Guard intends to conduct fit testing on in the coming days and into next week. We again thank the men and women of the National Guard for their joint efforts with us to make sure as many healthcare providers across the state are fit tested and can take advantage of N95 masks. So with that, I'd like to turn things over to Commissioner Lambert. Commissioner?
Thank you, Dr. Shaw. I am pleased to announce that new federal funding will be used to expand lab and testing capacity across the state of Maine. This week, we received $52.7 million in federal funding from the U.S. Centers for Disease Control and Prevention to respond to infectious diseases, particularly COVID-19. This funding is being provided through the existing program that supports epidemiology and laboratory capacity for infectious diseases. Governor Mills outlined 3 primary goals for the $52.7 million. First is expanding the state's lab capacity. The state is aiming to expand both in the short term and long term the capacity at the state's health and environmental testing laboratory called HEDL. This includes expanding physical space and increasing staffing to accelerate the number of testing options it has. In the long term, the state intends to accelerate the construction of its new lab in Augusta, which broke ground prior to COVID-19. Investing in a state-of-the-art lab will facilitate COVID-19 response, innovation, and public health generally in Maine. Second, we will bolster rural hospital lab capacity. COVID-19 has underscored the long-standing challenges that rural residents in Maine face in accessing timely health care. Building on the Mills administration's initiative in rural health transformation, the Maine CDC will work with rural hospitals to expand lab capacity to help them respond to COVID-19 and other infectious diseases. And third, we will support additional drive-through testing sites in the state. As the state lab ramps up its testing capacity, the state of Maine also aims to increase the number of testing sites outside of healthcare office settings. Currently, Maine has 38 testing sites outside of office settings. The state is exploring partnering with businesses and others to establish new so-called drive-through swab and send sites in Maine. This would allow primary care providers to recommend patients get testing in sites that are both safe and accessible. As Governor Mills said, this work is in the initial stages and will take time over the coming weeks and months, but it would not be possible without the partnership of the congressional delegation. This funding was included in the Paycheck Protection Program and Health Care Enhancement Act, and these new initiatives build on recent announcement by the Mills administration to significantly expand its testing capacity in partnership with IDEXX. This has allowed for the elimination of testing prioritization system so that healthcare providers can recommend testing for anyone they suspect of having COVID-19. As announced earlier this week, clinicians may now order tests for symptomatic people and people without symptoms who are at risk for transmitting COVID-19 to others. We're very excited about this new funding. With that, I'll turn it back over to Dr. Shaw.
Great. Thank you very much, Commissioner. And we will now turn things over to our colleagues in the media. And today's first question goes to Kevin Miller from the Portland Press-Herald.
Great, thank you very much. First, a question for the commissioner, and then one for Dr. Shaw. On the announcement of the additional funding, federal funding, can you talk any more about the drive-through testing sites? Do you know how much money that is going to, how much of that money is going to go towards that? And how are you going about identifying additional sites, where they're going to be located? Any kind of additional details you can provide?
Sure. We will be providing additional details in the coming weeks. We just received the funding this week, and we have a policy of only acting once we receive testing supplies, test kits, and anything else from the federal government. So we're thrilled to have this money, and what we are trying to do is ensure that we have additional local sites where, rather than an individual who is suspected of having COVID-19 is going into a clinic or into an office, sitting in the waiting room and waiting for a test, we've seen throughout the nation and in parts of Maine these drive-through testing sites that allow for the collection of the specimen and the safe transmit of it to our lab, to other labs, so we can really efficiently ramp up the capacity that we now have at our state lab and in other sites. So we are working both with Maine CDC, but also with the Department of Transportation, for example, who is looking at places and sites in Maine that people can drive through these sites safely. So we're not causing congestion, we're not causing traffic backup, and we're making sure that that testing capacity is accessible locally. So we are working with our colleagues, our mapping colleagues, our epidemiology colleagues to figure out what are the appropriate sites and sources of testing.
And Kevin, yeah, go ahead, Kevin.
I'd say just a quick follow-up question on that. Do you have a sense for how many test results you're getting through these drive-through test locations now? Is it a large share?
It's not a large share right now. I don't have the exact number. It's been about a week since we've taken a look at that exact cutout, but it's not a significant share. But I should say we don't always know exactly when a specimen comes from a drive-through swab and send facility. Fundamentally, what we know is which laboratory it comes from. We may not necessarily know the nature of the collection.
Okay, great. And for you, Dr. Shaw, on a related testing issue, we know that some urgent care facilities are now or will soon be offering what I believe is PCR testing, even to those who haven't necessarily gone to a primary care doctor first. It sounds like those results would probably be sent to other labs, to private labs. But how do you see this as fitting into the state's overall testing strategy?
So Kevin asks about urgent care sites offering PCR-based tests, even if the patient is not a regular client of that clinic. So Kevin, before I answer that question, I wanted to build on something that Commissioner Lambrou noted with respect to the drive-through swab and send sites. As we've talked about at these meetings, a large plank of our overall testing strategy and what is afforded to us by the expansion in capacity is now the ability to test individuals who do not have symptoms but may have been exposed. For example, close household contacts. But saying that we'd like to test close household contacts presents a bit of a conundrum, because if they're supposed to be staying inside, how do we get them tested? The drive-through model is a safe way for someone who's a close household contact who doesn't have symptoms to still get tested without exposing large numbers of individuals. So that's a key piece of the public health piece. Kevin, you noted, then you asked about urgent care centers. And right now where we are, although there is a benefit to going to see your primary care physician if you're not feeling well, certainly we're at a position where we welcome additional actors, additional swabbers and senders to the table. Depending on which laboratories those are sent to, we're hoping they already have an existing electronic relationship with Maine CDC. So when those specimens get sent, they'll be electronically reported to us immediately, and thus they'll appear in our figures. And so we would ask that any of the large laboratories, large urgent care centers who might be tuned in to please have your labs touch base with us before you start sending a significant number of samples. That way we'll make sure we capture all the details.
Thank you so much.
You bet, Kevin. We're going to turn now to Emily Tadlock over at WABI.
Hey, Dr. Shaw. So my question today, anyone is now supposed to be able to get a test, but we spoke with Dr. James Jarvis from Northern White Health yesterday, who says EMCC is not yet offering that to everyone because they don't have enough swabs. You say more on the way, but how many more do these hospitals need so that they can actually start testing everyone? Sure.
So Emily asks about right now who can obtain testing. And I've been in touch with Dr. Jarvis about this exact issue. He and I, we've spoken many times during COVID-19, and on this exact issue that you raise, Emily, he and I have exchanged emails on this precise issue. So I'm definitely aware and understand where Dr. Jarvis and a number of healthcare providers are coming from. You know, what we've sort of announced at Maine CDC's laboratory is that our doors are much more open than they were before. But that's only one piece of what's needed in order for someone to really get a test. Now, we've removed a lot of the internal prioritization schemes that we had in place that were necessary to preserve the number of reagents that we had. But we fully recognize that as we've opened up our doors and allowed more doctors to send tests to us, we also need to equip them with more swabs. As I mentioned a moment ago, just today, we are sending out about 9,000 swabs and about 8,300 test kits to make sure that as many hospitals and healthcare systems that need swabs can get them. But we know that more are on the way. As more do come available, we'll make sure we send those out. Our goal is to cast the widest net as possible so that any healthcare provider who believes clinically that the patient in front of them needs a test, that healthcare provider does not need to worry about the availability of swabs.
Sure.
Fundamentally, I'm sorry, Commissioner, fundamentally the ultimate decision of whether to offer a test to a patient is still one in the clinician's hands, but we want to equip them with everything.
And I was just going to make sure that point gets underscored. Any one means any clinician. It doesn't mean any individual.
Right.
At this point in time, as a reminder, our health alert on Monday, our guidance is either people who are symptomatic or people who are asymptomatic for whom the clinician believes there's a risk that that person has COVID-19.
Mm-hmm.
That's distinct from other terms you've heard Dr. Shaw talk about. Sentinel testing, which is sort of like spot checking to see what is the underlying prevalence of COVID-19 in the population, or universal testing, which is everybody irrespective of their risk because of a factor,
right,
be it they're in a congregate living setting or other settings. So,
and I am glad you bring this up, Emily, because what we've also spoken with clinicians about is the fact that clinicians themselves, their healthcare systems, their clinics, may have their own algorithms for who should be tested. The fundamental decision of who should be tested is ultimately the one of the healthcare provider, at least for what we're talking about. And so different clinics may have different rules, different guidelines that they follow. We included in our alert the Infectious Disease Society's guidelines, but there are other ones out there, and individual clinics may prioritize testing or offer testing to different patients in different ways. Let's see. Oh, go ahead.
If that's okay.
Sure.
Well, maybe you both could maybe answer this, but this new lab that you guys have broken ground on, since you're accelerating things, maybe you can tell me, I'm not sure if you can, but when do you guys expect that to maybe be finished? And, you know, what is that actually going to look like in terms of how many new tests and things could be run at this new lab?
Sure. So working with the Maine State Legislature last year, we got the support and authorization and funding to begin to replace the current lab, which is filled with high quality equipment and top-notch staff, but is in a very old and small building. Mm-hmm. So we have been seeking this new lab now for a long period of time. We did, as I mentioned, break ground on it last year. Because of COVID-19, though, much of that planning had changed previously. As you know, the governor has been talking about her concerns about the budget, about revenue, et cetera. So we, like every other department, thought about what do we do in this new fiscal environment about the lab. Mm-hmm. These new dollars, this new 100% federal funding for exactly this purpose, lab capacity, will help us go back to that planning and hopefully accelerate that lab. Mm-hmm. Again, we just received the funding this week. We don't have a specific schedule, but we really do look forward to moving our top-notch staff and our top-notch equipment to a facility that really can allow us to expand the way we'd like to.
Yep, it's the facility they deserve, exactly. Yep. Thanks, Emily. Let's see, next on the list is Prime Minister Don Kerrigan.
Thank you. Thank you very much, Dr. Shaw. That's the highest rank yet. Regarding the testing, this one's for Dr. Shaw, and then I do have a separate question for the Commissioner. As we've talked multiple times, there are a lot of people out there who suggest that we need to do significantly more testing even than we are currently doing, 3,000-4,000 tests a week. Will this money enable you to expand testing that much? And does CDC have the capacity to manage all of that testing, including coordinating with various other entities that do the testing?
So I think the one-word answer to both of your questions, Don, is yes, both in terms of the need to do more testing and the ability of CDC to manage that. Just this morning, Commissioner and I had a meeting with some external stakeholders to think about ways that we could continue expanding our testing capacity. We've already done so in very significant ways just in the past week, but we're not resting on those laurels. We know that we need to keep expanding it. So in light of the additional funding that we've just received and are announcing today, we started looking at plans that we could put into place to expand that capacity. It really entails a couple of things. We need additional space, as the Commissioner has just noted. We'll need additional testing equipment, and we'll need additional staff. So those plans are what we're putting into place right now. This money is critical to helping us get there.
Okay, and as a follow-up, I realize you're just starting. Do we know any, do you think some of that will happen this year?
I think the short answer again is yes. We are working night and day. We appreciate the fact that while we feel good about the announcements this week, we feel grateful that we have the capacity now to test all people suspected of COVID-19. We know that we want to get to sentinel testing, to repeated testing, to testing in different situations to make sure that we continue to try to prevent the spread of COVID-19 in the absence of a treatment or vaccine.
Mm-hmm. And Commissioner, I had one other question for you, unrelated to the testing. The state has a significant amount of money provided by the federal government in COVID-19 relief that I believe is, to use a colloquial term, sitting in the bank, more than $1 billion. Will you be using some of that to help out various social service agencies that provide mental health services because of the expanded need for those services?
Sure. And we have, over the course of the past several months, made several announcements about the use of federal funding. For example, we were grateful to be able to expand and increase our food supplements, our support for low-income families who may be out of work and may need that help. We also use federal dollars to help support child care centers because we know it is critical to have child care open for our essential workers, for our frontline workers, our healthcare workers, and people returning to work as the economy begins. So we moved out significant funding in that direction as well. We supported our hospitals. We put out $10 million in April in supplemental payments to our hospitals to support them in preparing for COVID-19. And we also supported our nursing facilities, providing them with exceptional circumstance allowances so they could pay for the extra PPE and extra staff that they may need to manage through the COVID crisis. We continue to look at all of our providers, including behavioral health providers. How can we continue to support them? But going back to something I mentioned earlier, we've been working on telehealth as part of our rural health initiative for the past 14, 15 months. Mm-hmm. That positioned us very well to be able to go into the recommendations to stay at home to provide telehealth, including telebehavioral health. So we continue to work on that. We'll be announcing some more activity in the coming days and weeks, but we care passionately about making sure that the mental health, the substance use disorder treatments that have been provided before COVID-19 continue through this crisis, but in new and innovative ways. So you'll be hearing more from us on that too.
Thank you.
Thank you, Don. We'll turn next to Patty White at Maine Public.
Thanks very much, Dr. Shaw. I wanted to ask you, As the state's opening up, I think there's some confusion about how people can safely reconnect with social circles in person, especially for kids. Can you give some recommendations on what are appropriate activities kids can do with friends? And do they start with one friend or two and then kind of slowly build out from there? Can you give some guidance?
Yeah, that's a good. So Patty asks about as folks reconnect and as we look at going into a holiday weekend, what are the best practices for kids and children as they look to reconnect? And Patty, in this situation, the overall advice is not significantly different for kids as it would be from adults. The smaller the gathering, the better, and the gathering limitations and the advice on those remains in place. And I think the same steps that we've recommended for adults would equally apply, if not more so, with children. Hand hygiene, covering their cough, if children aren't feeling well, trying to make sure that they're not exposing others. So there's nothing especially unique for children that wouldn't also be applied to by the adults that are with them.
And I'll just add that we did issue our checklist for day camps yesterday. We recognize the importance of children getting outside. Yeah. And I think Governor Mills has, throughout COVID-19, emphasized, nothing about this disease says stay at home, not exercise. We want kids especially to get up and get outside. And so we're trying to promote safe ways to do that.
Thank you, Patty.
Thanks.
We're going to turn to Megan at WMTW next.
Thank you for taking my question. I actually have two. The first one is for you, Dr. Shaw. It's quite quick, but we were alerted or kind of given a tip that there might be an outbreak at the Tam Brands facility. I wondered if that was something that you guys were looking into, that the CDC was investigating possibly, or that it was on your radar.
It is on our radar. I was made aware of this not too long ago. We don't know whether that is an outbreak or whether it happens to be individuals who may happen to work there who may simultaneously have COVID-19, or whether the facility itself is the nexus of all of those cases. That goes back to that epidemiological link that we've talked about that's really essential. We're aware of it. We're looking into what the facts are, how many individuals may be associated with it who have tested positive. And then once we get our head around those facts, starting to work on an investigation to determine whether, again, it happens to be several individuals in parallel who happen to work there who are COVID-19 positive, or whether the facility or the workplace itself might be the place of transmission.
Okay, makes sense. And I also have a question that might be for both of you, and it's very similar to Patty's question, but we've had a lot of viewers particularly concerned about childcare as they go back to work, as the state begins to open up, and a lot of parents are sort of wary, despite the detailed checklist that these daycares need to follow in order to open up. Is there something that you can tell parents, or can you sort of assuage these fears in any way about these safety precautions that are being implemented? And, do you feel that it's safe as of June 1 to send kids back to daycare? We all know how communicable certain illnesses are in those settings.
Sure. I'll let Dr. Shaw speak to the communicable part of the disease. But just to go back to your question, the state of Maine takes its responsibility to keep children safe extremely seriously. Our Office of Child and Family Services from day one has put out guidance to child care providers about how to take care of children safely. And to date, we have been successful. We really have been able to prevent any known outbreaks of COVID-19 in a child care setting. But that requires vigilance, so we encourage all of our child care providers to continue to look at that guidance. It gets updated periodically as we learn. As more people go back to work, there'll be more of those child care centers opening. We, I think, have had about 50% throughout the peak of COVID-19 of facilities cutting back on their offerings, or 50% of the spots have not been open. That's beginning to decrease as people go back to work. So we encourage all of our child care providers to check out those guidelines and keep those children safe. Going back to daycare, though, day camps, that's different. That's outdoor activities. These are camps that are summer camps. They can begin operating on June 1. with these guidelines, similar to childcare, but mostly they're outdoor activities, which helps
And the day piece is what's
Correct.
important there. They're
Not
not
overnight camps.
overnight camps.
at this point.
And the commissioner noted that, so the checklist, the guidelines are incredibly thorough and have really thought through every single opportunity to reduce the likelihood of transmission. But in any situation, reducing the likelihood of transmission of any infectious disease can't get it to zero.
Yep.
And so what we would fundamentally still recommend is two things. The first, it really does underscore the importance of bringing your child in for their scheduled well child checkups to make sure that your child is doing well and is up to date on all of his or her vaccines. The second is if you've got outstanding concerns about going back to daycare, this is a perfect opportunity at those well child visits to check in with your pediatrician or family practitioner, because they'll be able to provide that really specific one-on-one advice for you. Great. Thank you, Megan. We're going to turn next to Brad Rogers.
Okay, thanks. I have a question for each of you. First, for Commissioner Lambrou, where exactly did you break ground on the state lab, and has any construction actually started at that location? And also, how much is the cost to build this state lab, and will this federal money cover most of it, if not all of it?
Sure, and the questions were about our state lab that we're building across the river in Augusta. It is on or near the site of the old AmHi building in Augusta. The ground was broken last year, but again, it's like using an existing building, so I don't think you'll see a big construction site. We continue to kind of advance that, and we can get you that information on the original cost and any additional costs as we restart that project soon.
Yep. And Brad, you had a question for me as well?
Yeah, are your contract tracers involved at all with the prison in Wyndham as far as tracking it down, or is it being left up to the staff there to do that? And what I wanted to know, and I don't know if you know the answer to this, but do you know how many people that prisoner came into contact with?
So Brad asks about the situation at the Maine Correctional Center. And Brad, your first question is whether Maine CDC's contact tracers were involved there. It really is a joint effort. So our epidemiologists are working with the corrections officials. The corrections officials are really the ones kind of getting a sense of who this particular inmate was in contact with, looking at work rosters, schedules, things of that nature. So it is a joint effort with our epidemiology and contact tracing team and the officials at DOC. In terms of the number of individuals this client came into contact with, I don't have that information. I think DOC would probably have it very quickly, though.
Okay, thanks.
You bet. We're going to turn next to Isha over at the BDN.
Thank you, Dr. Shah. I have two questions for you today. Both are about antibody tests. The first one is, given the reliability issues and the fact that antibody tests are not part of Maine's testing strategy, what is the value of antibody testing in Maine's response to the pandemic?
Sure. So Isha asks about the value of antibody testing as part of the overall approach to thinking about COVID-19. And Isha, I wanted to just note one thing. Although right now there are questions about the utility of antibody testing, we're looking at it very closely. So it is part of our strategy, but it's probably one that we would look to operationalize in concert with hospitals and other laboratories a bit later on in the future. So it is part of the strategy, but it's one that the science is still being done on. But the overall value of antibody testing today, it really, based on the recent calls and articles that we've reviewed, is fundamentally one of, if someone is involved in an academic research study, that's definitely a role. If someone is looking to donate their plasma for so-called convalescent plasma use, antibody testing is integral to that. But beyond those quarters, there are still questions about the accuracy of the test, first of all, and then secondly, the interpretation of any of the results that you might get. Even if you happen to get an antibody test from one of the machines that is incredibly accurate, we still don't really know how to interpret that. And that's because we still don't really know what kind of a virus, coronavirus, is going to turn out to be. Is it going to be like chickenpox, where once you've had it, you're protected for pretty much the rest of your life? Or is it going to be more like the flu, or the common cold, where just because you had it in November doesn't mean you're not going to get it again in January. The science on that is still being done, and as we learn more about it, we'll be able to bring into much sharper focus what the value of antibody testing is.
Okay, thank you. My second question is, when did the CDC start including antibody tests in the daily case counts? And are you concerned that combining both viral and antibody tests into the total positivity rate distorts where the state should be in terms of reopening?
No, and I want to be really clear, and you've conflated two things, so respectfully, Isha, I want to make sure we disentangle those. The first is case counts, and the other is positivity rates. And they are separate, even though they are related. As soon as Maine CDC began receiving laboratory tests for antibodies, antibody tests that were being done, that was around the exact same time, and partly because of that, we introduced a new category of probable cases. On our website, anyone can take a look to see what the exact definition of a probable case is. There are two ways someone could be determined to be probable. One is that you're a close contact of a confirmed case, or you do have a positive antibody test, and you also have to have at least 2 symptoms. And those are the 2 definitions for what constitutes being a probable case. We always break out the total number of cases, and we break it out by laboratory confirmed, which means a PCR test, or probable, which could be one of those 2. So we've always been clear about those and reported those transparently ever since they went up on our website. Now, you separately asked about positivity rates. Every time we announce what our positivity rate is, as I did yesterday, we break it out by positivity for PCR, positivity for antibody, and the overall positivity. We're wanting to be as transparent as possible because those numbers tell you somewhat different things. The PCR positivity is an accurate snapshot of the current state of the infection. The antibody rate is a better reflection of what might have transpired 1 to 10 weeks ago. And the blended average is just that, a blended average. So even yesterday when I reported the numbers, and on our website, we broke them out. But I wanted to make sure I disentangled the case counts from the positivity rate. And the last, you bet. The last question today goes to Patrick Whittle from the AP. Patrick, are you able to chime in? We'll come back to Patrick. That was the last question. Patrick, anything for Commissioner Lambrou or me? Okay, well, hopefully Patrick will be able to join us tomorrow. Commissioner, anything on your end?
No, I will just note that yesterday when Dr. Shaw was talking about the positive rate, I think it was safe to say, while some of the numbers look alarming, we see a lot more cases this week than we've seen last week. Mm-hmm. The test positive rate has gone down.
It has.
But I think it's also important to note we also track how does Maine compare to other states, mm-hmm. and we're basically the same as we were last week. Mm-hmm. Last week we reported on a per capita basis that we were 46 in terms of cases, 6th lowest in the nation, 39th on deaths, again relatively low, and 28th out of 33 states reporting hospitalization. So we do continue to provide you this information, and we'll continue to track these outbreaks, but I think it's important to put these numbers in context.
Great.
Thank you.
Great. Thank you very much, Commissioner Lambrou, and I'd like to thank everyone for joining us this afternoon. We very much appreciate everyone continuing to join in, hear the latest updates about COVID-19 across the state. Thank you all so much. Have a great afternoon, and we'll talk tomorrow. Thank you.